An investigation conducted by the Daily Mail has shed some light on the NHS's approach to gender issues. Now, according to NHS internal guidance, the societal divide between men and women is attributed to colonialism. I guess that's good then. I mean, the end of British colonialism is commonly signified by India's independence 76 years ago. Given the fact that a load of NHS nurses are indeed Indian-born women, I think we might have smashed that barrier. Or maybe simplifying the divides in gender to a long past irrelevant practice is a well-designed scapegoat to hide the real threat to feminism, which is, in my view, extreme trans ideology with no basis in reality. And, you guessed it, the internal guidance is chocked full of that stuff as well. Individuals who occasionally decide to be a woman for the day, literally for the day, are allowed into female-only wards. Midwives have received guidance to avoid referring to trans parents giving birth as actual mothers. And 999 operators are directed to ask about emergency callers' pronouns to avoid potential misgendering. I would argue then it's not an emergency, is it? But every second is crucial in a life-threatening situation, which unsurprisingly is par for the course for those 999 operators. The suggestion that they should waste their time inquiring into an individual's pronouns is absolutely cruel. But these revelations have ignited calls for an urgent review of NHS guidance matters into gender. I am joined now by author and broadcaster Ella Whelan. Ella, thank you very much. Tough to know where to start on this one because there's so much guff, isn't there? But what do you make of the NHS's gender guidance and then blaming our gender inequality on colonialism?
Well, first of all, it's rather odd that the National Health Service, which is supposed to be bothered about how people engage with its services in this country, should be making sort of international statements about how people deal with gender and sexuality, or whatever. This is a kind of a policy that could be lifted from a university students' society. It's probably about as well written as would come out of something like that. And, you said it in your introduction, it seems like a giant waste of time. And the reason why it's a waste of time is because there have been, the transgender patients might have increased in number, but they haven't just been discovered in the last year or so. There have been people with that kind of issue and those kind of requirements for a very long time. And staff have been pretty good at dealing with people, actually. There's been a sort of, I've spoken to quite a few nurses and doctors who, off the record say that they're really quite insulted at the idea that they have to have this kind of policy and guidance breathing down their neck, telling them how to formally interact with their patients, when actually bedside manner and managing people's personal lives as well as their medical difficulties is part and parcel of being a medical professional, and they're already very good at that. So there's that kind of aspect of this being really kind of hectoring for staff. But it's also the case that this isn't just a silly policy. It has very real ramifications for whether or not women's wards can be women only, whether or not the way in which it's always about women, and whether in which the way women interact with health professionals is in a kind of normal basis, or whether it's littered with all this ridiculous language. The funny thing is, a lot of the discussion about gender neutral language that takes place in the most obviously gendered area of healthcare, which is maternity care. I don't really know why there's such an obsession with gender neutralising maternity care when it has such cruel and cold ramifications for removing words like mother, mum and woman from that particular area of a woman's life. So it's not surprising, but it's certainly depressing.
Ella, thank you very much. I didn't want to interrupt you there because I just thought it was an absolutely fabulous monologue that no doubt will be clipped and pumped out on social media far and wide. Ella, thank you. Ella Whelan there.